Hi, my name is Dr. Mae Sheikh-Ali, and I am your internet endocrinologist. Here's a question for you. How would you feel if, while unconscious, someone examined your private areas without your consent and without any medical necessity? Years ago, while I was rounding in hospitals and covering for providers over weekends, I came across a situation that really shook me. I discovered that a sensitive examination had been performed on an elderly male patient in his 80s who had been unconscious and bedridden for several days. When I walked into the room and saw him, it felt like I was looking at my own father, and I couldn't hold back my tears. What made it even harder was seeing his family standing around, completely unaware that their loved one's privacy had been violated in a place where he should have been safe. I just couldn't wrap my head around how a provider could perform such an unnecessary exam that had nothing to do with the patient's care. What really struck me was that this provider seemed to only perform these sensitive exams on male patients, never on females. These exams were consistently unrelated to the patient's actual condition or reason for being there. To make matters even worse, there wasn't a chaperone present, which made the whole situation even more distressing. I immediately reached out to the providers with privileges over him, sharing my concerns and insisting that this unacceptable behavior had to stop. I was assured that the issue would be addressed, but when I returned for my next rounds, I saw the same troubling behavior continuing. Feeling frustrated, I decided to confront the provider directly. I told him that a chaperone needed to be present for these exams, especially with vulnerable patients. His reaction was one of complete shock, as if he couldn't believe I knew what was happening. Without saying a word, he simply walked away, trying to avoid the confrontation. A few weeks later, things took an unexpected turn. I was informed that my services were no longer needed at the hospitals, and that another provider would be taking over. When I asked for an explanation, especially since this change would impact my income, and I had never raised any complaint about my work, I was met with a vague response. Despite this, I stayed committed to patient safety and ethical practices, though it was disheartening not to see the issue resolved. In the course of my research on patient safety and comfort, I discovered some important findings regarding the use of chaperones during sensitive exams. Interestingly, a recent review by the Medical College of Wisconsin and Louisiana State University Health revealed that over a quarter of patients felt uncomfortable asking for a chaperone if one wasn't offered. The review pointed out that patients shouldn't have to request this. In the U.S., 7 states, Alabama, Delaware, Georgia, Montana, New Jersey, Ohio, and Tennessee have legal mandates for medical chaperones during sensitive physical exams, with serious legal consequences for not complying. While Florida doesn't have a legal requirement, The Florida Board of Medicine strongly recommends using chaperones to protect both patients and physicians, especially for the vulnerable patients who cannot give informed consent or protect themselves. A chaperone is essential during sensitive exams. I am sharing this story not to create panic or negativity, but because it is so important for both patients and providers to know their rights. Please share this video with everyone you know. Do it with the intention of spreading knowledge, because you or I could easily find ourselves in a similar situation. And keep this in mind: knowledge is power. When you know your rights, you are empowered to ask for what you deserve without hesitation. While Florida doesn't require chaperones by law, you have every right to request one during sensitive exams and to ask why the exam is necessary for your treatment. If you see a provider performing an exam on a vulnerable patient without a chaperone, do not hesitate to ask for one. It is about respecting that patient's dignity. Remember, energy flows where attention goes. Sending out positive energy and standing up for what's right brings back positive energy. What goes around comes around. So let's ensure we contribute to a world of respect and care, because in the end, our own energy shapes our reality. If you found this episode valuable, please give it a thumbs up, share it with your friends, and hit that subscribe button so you don't miss any future episodes. Knowing that you find these episodes valuable keeps me creating the content that truly matters and reaches those who need it. Thank you for tuning in, and I will see you in the next episode.